Good afternoon, everybody. Thank you for coming. My name is Bob May. I'm the Executive Director of Lancaster EMS. I want to welcome members of the press, Lancaster EMS employees, our board members. We have 3 board members here today. Of course, Dr. Levine, Commissioner Trago, and also we have a few leaders from the EMS Bureau office here as well. So again, welcome to Lancaster EMS, our Millersville station. And for those that may not be familiar, Lancaster EMS is the largest EMS agency in Lancaster County. We're the only accredited agency in the county as well. Our roots were established about 25 years ago when several local hospitals combined forces. They divested ambulance operations to form Lancaster EMS. With over 160 employees, we proudly operate from 11 stations within a 21 municipal 911 response area, serving a population of about 260,000. In 2019, Lancaster EMS was dispatched for over 39,000 requests for service. And with that said, we are humbled to have Governor Wolf. And Governor Wolf, my statements are concluded.
Thanks, Bob. Thank you. Thank you very much, Bob. It's really nice to be here. And I just want to say that with my hairline, I really appreciate the fact that I'm in the shade here. This is really nice because a couple of these I've been outside. I feel sorry for all you guys out there. But I am here to say thank you to everybody who either volunteers or serves for an EMS company or a fire company. And I really want to thank you for allowing me to be here. Bob, where'd you go? Bob, back. Yeah. Thank you for having me here. As all of you know, the EMS workers have been on the front lines. They're always on the front lines, but they've been especially on the front lines during this COVID crisis. They've had to do all kinds of things to adapt, to keep themselves safe, and to keep their patients and the people they're serving safe. And again, they've done this while they're continuing to do what they've always done and serve as a lifeline to their communities. This has happened at a really interesting time because while they're doing so much more than they've ever done before, their fundraising capacity has been restricted. I mean, across the state, fire and ambulance companies have had to close down their bars, had to cancel carnivals, and they've had to shut down other sources of funds for these organizations. So at the same time they're doing more, their opportunities for fundraising is actually less. This is something that is I think, worthy of note because it's really important that all of us recognize, especially now, how much that they're doing. But anyway, the patient volume is another thing that I think hospitals have seen as they've dealt with the COVID-19 crisis. People have felt reluctant, and we've been dealing with this, reluctant to come into hospitals. It's safe. They're doing everything they can to protect their patients, but patients and people are understandably reluctant to go to hospital. That's another thing that actually harms the cash flow for organizations like this. All of this stuff isn't good. So we need to do everything we can to support these heroes. Again, the ones who do the things that we need them to do on the front lines. We can thank them with words, and I'm happy to do that. And I think there's not enough thanks, enough gratitude that we can express. But I think we need to back that up. So the legislature and I together saw this need. And in June, we enacted legislation that provides $50 million in direct financial relief to fire and EMS companies all across the Commonwealth. I just want to make sure you know grant applications, well, you already know, grant applications are due August 7th, and we have already received over 1,100 applications, including from Lancaster EMS. You've already applied for this. And I'm glad that you have, because you deserve the help. And here at Lancaster EMS, you're going to be using this to buy equipment like a decontamination spray system. It's going to help you sanitize facilities here and all the other things that you're doing. I'm proud of this program. It's something that again, adds some concrete show of gratitude to the thanks that we're saying all the time, and we ought to say. But it's the kind of thing that I think we need to do to protect and help the folks who are helping and protecting us. Again, you guys, Lancaster EMS and EMS all over the Commonwealth have responded really bravely and amazingly to this COVID crisis. And even during this time of hardship, you've provided safe and competent and compassionate emergency care that makes Pennsylvania's EMS network second to none in the country. So thank you very much. And one final reminder, you can watch this press conference and others on our social media pages on pa.gov. With that, I'm very proud to turn this over to my colleague, Secretary of Health, Dr. Rachel Levine. Dr. Levine.
Good afternoon. Thank you, Governor Wolf, for that introduction. For our data update today, as of 12 a.m. this morning, we had 860 new cases of COVID-19 in Pennsylvania. This brings our statewide total to 111,078 Pennsylvanians who have tested positive for COVID-19 in all 67 counties. Tragically, 7,176 deaths have been attributed to COVID-19. It is truly an honor to be here today to thank our EMS providers for the work that they do all the time, not only during this novel coronavirus, COVID-19, but all the time, each and every day. I also want to recognize our Deputy Secretary, Ray Barashansky, and our EMS Bureau Director, Dylan Ferguson, who are here today, and thank them for all of their hard work and dedication to the community. We know that our EMS providers across the state face numerous challenges. Challenges like obtaining the latest technology for their work. Challenges, as the governor said, to have sustainable funding. Challenges like the opioid and overdose crisis, and of course, COVID-19, and much more. And we know that our EMS providers respond to more than 1 million requests for service each year in Pennsylvania. This includes dealing with patients with serious life-threatening health issues, including heart attacks, overdoses, and of course, at this time, COVID-19. While our EMS teams are prepared to respond to emergencies, they're really not the first line of medical care for routine illnesses. Hospital and physician offices are taking proper precautions to prevent COVID-19 exposure. So please, as the governor mentioned, do not delay your medical care, whether that is for an acute issue or whether that is for your checkups and chronic medical conditions. Please seek out your healthcare providers and obtain that necessary care. When you do, it can lead to these concerns becoming better so that you don't delay and so that they're life-threatening. Our EMS providers are vital, integral parts of our communities, and I want to personally thank them for joining us once again in a fight to stop a disease from ravaging Pennsylvania. Now, there is an important way that all of us can thank our EMS providers, and that is to wear a mask. When you wear a mask in public, you are showing respect for our frontline EMS providers, and you are actually protecting them, protecting our EMS providers who are our true frontline responders. Wearing a mask is one of the easiest things that we as Pennsylvanians can do to stop the spread of this very contagious and dangerous virus, COVID-19. When you wear a mask, whether you are walking on the street, whether you're inside a grocery store, shopping at a retail store, or even outside in a park, it is a sign to the whole community and to our Commonwealth that we are all in this together. And what is most important for Pennsylvanians to remember, stay calm, stay alert, and stay safe. Thank you. And now it is my pleasure to introduce my friend and colleague, the Pennsylvania Fire Commissioner, Bruce Trago.
Thank you, Secretary, and thank you, Governor, for the opportunity to join you down here today to say a few words to the folks we owe a debt of gratitude to. Thank you so much for what you do. It's important that we not only thank you, the professionals that are doing this day in and day out, but also to thank the families who support you every day and allow you to do the things you do. So please remember to thank them as you will. This year has brought many challenges to the emergency response community. And as always, we've met these challenges with perseverance, teamwork, new ideas, flexible attributes, and most importantly, with your steadfast dedication to serving those in need during a constantly changing environment. This whole thing has been a moving target, and your flexibility is well noted and appreciated. This new environment, or new normal, as it is also addressed, is and will continue to be difficult to navigate. Some have repeatedly stated that we are in uncharted water, or maybe another good example would be attempting to drive to an unfamiliar address without a map. Okay, so there may be those of you that don't know what a map is, never used a map, but in this new normal, we now have what's GPS and other electronic devices to assist us. This is a perfect example of how things are changing and how we use new technology to adapt to this new environment. We must also learn from our past to eliminate or at least decrease the number of mistakes of the past so we don't repeat them. We've all made a mistake or two, and shame on all of us if we do not learn from it or we repeat it. Experience is a wonderful educator. Sometimes we get the test ahead of the lesson. An important lesson that we sometimes fail to recognize from our past experience is that of our behavioral health. Do we ignore the history of those who have suffered from some form of job-related stress, or do we learn from the past that we collectively and as individuals can prevent the serious results of ignoring those signs and symptoms? For a moment, let's just take a short break from all the chaos. As was mentioned by the Secretary and also by the Governor, we have been, and you have been on the front line of a multitude of things. The opioid crisis, COVID, not to mention the things that you were doing before that tied up all your time. So let's take a break from that for a moment and look at something that is very near and dear to my heart, and that is the loss of our fellow responders due to suicide. In the year 2017, we lost more first responders to suicide than we did to the line of duty deaths. According to the Firefighter Behavioral Health Analysis, in 2017, we lost 123 first responders, 106 firefighters and 17 EMTs, and one what they call communication specialist, or we call telecommunicators. My son's one of those, so I can't call them a dispatcher. They're telecommunicators. In 2018, we lost 114, 92 firefighters, 22 EMTs, and 2 communication specialists. In 2019, we lost 139, 119 firefighters, and 20 EMTs. So far in 2020, we've lost 63, 47 firefighters, and 16 EMTs. This, unfortunately, has placed Pennsylvania in the top 10 in comparison to the other states in suicide by first responders. The top is Illinois, then Florida, California, Texas, who is tied with California, which makes them a tie for 3, and at 4 is Pennsylvania. That's certainly not a distinction that we want to continue. We want to lower that at any cost. So what can we do? We need to start with ourselves. Jim Dill of the Firefighter Behavioral Health Allowance has provided the following advice. We in the fire and EMS services need to practice doing an internal size up each day. It simply means we need to ask ourselves, why am I acting this way? Why am I feeling this way? It's a start. As individuals, we can no longer fall prey to the stigma associated with those who are suffering with some type of stress from the job, especially to that statement that has been made many times in the past when an individual would admit something on the last call bothered them. That statement was, "Suck it up, kid, that's part of the job." That stigma must be in the past, and we need to recognize that we are all human beings, we have feelings, and we are not all the same when it comes to dealing with the stressors of our job. Collectively, we must eliminate that stigma and see that it does not become part of our new normal. Every one of you has trained, works professionally, and you are on your A game when the people you are serving are probably having the worst day of their life. Is there stress there? Absolutely. Yesterday, we announced the availability of 4 online courses at no cost to PA, fire, and emergency medical services personnel. It's on Train PA. If you're not currently a user, you will need to register for the Train PA account, and the courses cover a variety of topics and they are titled, Being a First Responder During a Global Pandemic, Had a Bad Call, How to Support Your Fellow First Responders, and Capturing the Load. Those first 3 courses are about 10 minutes each, so you can take them when you're on a break. Pretty easy, not time consuming. The last one is Capturing the Load. It's a 1-hour program. In a conversation right before this started, Director, where'd he go? There he is. Director Dylan Ferguson has offered to assist us in getting Con Ed credits for you for that program. So please take advantage of these resources to help you, your peers, and your family. Thank you again for the opportunity to speak here today, and a huge thank you to you and your families for what you have done and what you are doing to service the citizens of the Commonwealth of Pennsylvania. It is now my pleasure to introduce Jerry Schramm, Director of Operations and Deputy Chief of Lancaster County EMS. Lancaster EMS. Thank you.
Good afternoon. I would like to begin by offering my appreciation to Governor Wolf, Dr. Levine, Commissioner Trago, and many other friends and resources here today to be with us and just recognize our staff and what we've done here at Lancaster EMS. Your presence here today recognizes the tireless effort delivered by the Lancaster EMS workforce throughout the COVID-19 pandemic. Lancaster EMS is the only nationally accredited ambulance service in Lancaster County. We pride ourselves on meeting the highest standards in the industry, consistently evolving and adapting to meet new standards and challenges. As such, Lancaster EMS quickly reacted to the pending COVID-19 pandemic in early February, developing a task force comprised of several key staff members, including our medical director, Dr. Mike Rehart, to evaluate current preparedness and create a response plan create a response plan should the COVID-19 virus reach Lancaster County. With proper pre-planning, inventorying of personal protective equipment, and a detailed internal response plan, the Lancaster EMS response to COVID-19 ensured a consistent level of response to our community, as well as maintained a high level of safety for our workforce. As the pandemic progressed, we continue to remain flexible, thorough, and dynamic. A substantial decrease in emergency and non-emergency call volume has gradually returned to normal levels. Early homemade decontamination equipment has been or is being replaced or complemented with purchased commercial decontamination equipment provided through state and federal funding support. Personal protective equipment, while initially cumbersome and uncomfortable, has become an acceptable practice for both clinical and non-clinical staff members. Breathing concerns voiced by staff members wearing N95 masks in high heat and humidity conditions are being addressed through the integration of P100 respirator masks. Rationed disposable gowns have been replaced by reusable gowns that are easily decontaminated. Routine vehicle decontamination efforts have exponentially increased, while most vehicles receiving daily decontamination several times each day. The community donations of PPE, decontamination supplies, meals, and other essential items have overwhelmingly contributed to the health and wellness of our workforce, both from a practical and an emotional standpoint. My heartfelt gratitude goes out to the community for your support during this pandemic. The success of Lancaster EMS's response to the COVID-19 pandemic is a testament to the dedication and efforts of our entire Lancaster EMS staff. It is now my pleasure to welcome Governor Wolf back to the podium.
So thank you, Jerry, and again, Bob, thank you very much for allowing us to be here with you and say thank you and show our thanks. Now I'm happy to open this up for questions. Yes? Okay.
Governor, I have a question for both you and Dr. Levine. I was wondering your reaction to Russ Diamond today, but also secondly, I was wondering from Dr. Levine, do you believe he was trying to make a comparison on the discrimination against LGBTQ in this community to those who don't want to wear masks?
Okay, I'll let Dr. Levine speak. I don't know what he was talking about. I mean, it seems to me that we can complain about gravity or stop signs or seat belts, but they actually make a difference, and it's a fact of life. The virus actually does better if people are not wearing masks. I personally would like the virus to do less well. I would like the virus to infect fewer people, and the fact is that if you wear a mask, it actually keeps other people from getting any infection from you. You're actually doing a nice thing for other people. So I don't get what the issue is with the face masks at all, and I certainly don't get why you'd actually conflate that with discrimination against people for their identity. And it just doesn't make any sense to me at all. I thought it was it was factually incorrect, and it was nasty. Dr. Levine, you want to say anything?
So my reaction is this is really another example of harassment against LGBTQ individuals. By taking my words and making that substitution, I think that that's another example of the disrespect to LGBTQ individuals that we have been seeing. I think that there are two issues. One is that in terms of masks, he's wrong. Masks are essential, and they are an essential public health measure in this global pandemic of COVID-19. That is accepted by local authorities, that's accepted by state medical and public health authorities, that is well accepted by national public health authorities. And so I think that by talking about masks in a negative way, it does a disservice to the public health of individuals in the Commonwealth. In addition, as I mentioned earlier in the week, I think that Never mind using my words as a comment on me. Really, what I worry about is the other LGBTQ individuals in the Commonwealth who regularly face intolerance and harassment and sometimes, as I mentioned, overt violence. So I think it was a very negative comment. I agree completely with the governor's press release and response in terms of the reaction to that comment.
Have either one of you spoken to him directly at all?
No. Thank you.
Let me just say one other thing. Working with Dr. Levine, she is, and I introduced her this way, phenomenal associate. We're lucky to have her in Pennsylvania. I'm not sure what's going to happen in Washington after the November elections, but I'm sure she's going to be in somebody's short list. She was on somebody's short list after the 2016 election. I just find she is a great resource. We in Pennsylvania are lucky to have her here. I'm lucky to have her in my cabinet. So thank you for everything that you do, Dr. Levine. Any other questions? Yes, Dennis. Yeah, okay, you're in the sun. You're in the sun, so you get to go first. He's in the shade. Come on.
Thank you. So locally, there have been calls for you to allow decisions about COVID mitigation to be made locally, especially given that COVID hospitalizations are down considerably in Lancaster County. Are you considering that, and why or why not?
Well, again, the state is everything is in green, so we are making local decisions. I've made some statewide decisions, like wearing a mask, and again, the limitations on bars and restaurants. But with the exception of that, the broad sweeping statewide changes that I made early on to buy time when we didn't have the resources we have now, or the information that we have now. I'm not doing that. So that's the first thing. The second thing is that when I do things from a statewide level, it's a recognition that this virus does not respect county borders, municipal borders, state borders. I mean, one of the things that's causing this upsurge that we're seeing right now in Pennsylvania is not because of anything we've done here in Pennsylvania, but we're paying the price for things that didn't happen in other states. So we're seeing this virus come east from the west and southwest. We're seeing this virus come north from, you saw the Phillies, Marlins. How many of the Marlins players and coaches tested positive? There are certain things we can do from a statewide level. There's certain things we can do from a regional level. I'm working with 7 states in the Northeast, working with New Jersey and New York on a plan to do some things right now to address the upsurge. But for the most part, it is in the hands of local folks to do what they feel they need to do. School districts, those are local school board decisions as to how they open, when they open. It's up to them to decide how they're going to do all kinds of things. So I'm not sure what you're talking about. Early on, as you recall, we didn't have masks. We didn't have protective equipment. We didn't have ventilators. Right now we have it. How many ventilators are being used by COVID now? 90-something? Around 100. We have 5,300 out there, and the state has another inventory in Harrisburg. So we have gowns. We're actually looking for warehouse space to house these inventories. So we have capacity in our healthcare system now that we just didn't have back in the early going, and it called for a really hard shutdown. We're in a different place right now, and I think by doing focused things at the state level on a very few cases, this has taken the place of the broad, blunt instruments that we had back in the beginning of the pandemic.
If I could, one more quick thing. Anything that you could say in general on how Lancaster County has been doing responding to COVID?
I just turn that over to Secretary Levine.
Well, first, I think that the medical personnel in Lancaster County, including here, but also the other medical personnel in the hospitals and the physicians and nurses and all the medical personnel have done an absolutely fantastic job taking care of very challenging patients with COVID-19. But as we've been saying, not only COVID-19, I mean, still have to take care of individuals who might overdose. The opioid crisis has not gone away, and other overdoses, in addition to people who have heart disease and diabetes, etc. So nothing but kudos to the medical personnel in Lancaster. Overall, Lancaster has done well in terms of COVID-19. There have been some ups and downs, especially over the last number of weeks, as we've seen all through the southern tier of Pennsylvania. It started in the southwest Pennsylvania in Allegheny County, but we have been seeing increases in southeastern Pennsylvania, Philadelphia and the Collier counties, and in south central Pennsylvania. The last 2 days, we're down a bit into 800 new cases a day. That's promising. We'll see if that trend continues. There's no way for me to predict. But overall, I think that Lancaster County has done an excellent job.
Governor, I'm sure you hear it too, but our news station gets a lot of reports of people not practicing distancing, not wearing masks, establishments that aren't following the rules. What do you want them to do? I know you've been very reticent to actually cite any of these places. Or do you want people to be turning others in? I know there was a release from your office yesterday about what to do if they see behaviors that are not good.
Yeah, and that was a good point. That was just a reminder to say, you know, these are enforceable mechanisms, and there are things that you can do if you're an employee and you're concerned for your safety. You have recourse, and so what I did yesterday was just to remind Pennsylvanians of what they can do. But I also recognize, and I think we all have to recognize that enforcement is not what makes stop signs work. How many times you've heard me say that? It's not what makes seatbelts work. It is that we've figured out that if we want to keep our family members safe, we want to keep ourselves safe, we have to do certain things to mitigate the risk of not stopping at an intersection, of actually not wearing a seatbelt. In this case now, wearing a mask is something that really protects people around us. If I wear a mask, I'm protecting you. If you wear a mask, you're protecting me. That's just a decent thing to do, and it works. You know, we know more now than we did back in the early going of this pandemic. This actually works, and so why wouldn't you want to do this? I don't know how this became a political thing.
The fact is, though, there are still people that aren't doing it, and that frustrates people that are. What is your message to those people as to what they're supposed to do?
Well, there is. I mean, I have a statewide mandate to wear a mask. I recognize that there are not enough enforcement officers around to go around and cite everybody, and that's not going to do anything anyway. As soon as the officer pulls out, if someone doesn't believe it makes a difference, they're going to take the mask off. I think what we need to do is open your minds and be open to the reality that this virus really loves it when you don't wear a mask. This virus is going to go from you to somebody else, and it might be somebody you care about. So why wouldn't you wear a mask? Do it. It's the right thing to do. It's the smart thing to do. It's the safe thing to do, and that's why we ought to do it. Ultimately, 13 million Pennsylvanians, each one of every 13 million, those 13 million Pennsylvanians are going to have to come to that conclusion, just as they did for seatbelts, stopping at stop signs. Does everybody stop at a stop sign? No, but most people do. Does everybody wear a seatbelt? No, but most people do, and more are wearing it every day. These are the kinds of things they're part of life. As we learn new things, we change behaviors. Right now, we know that wearing a mask works. We ought to do it. Yeah.
Governor, to follow up on the question that was asked in response to Representative Diamond, he's also asked for you and for Secretary Levine to resign, I think specifically to some of the decisions that have been made throughout this COVID process. Number one, what's your response to that? Secondly,
my response is I'm not resigning. Are you?
No, sir.
No. Okay. There's.
Secondly, you also called on as part of your statement earlier today, a resolution condemning his statements. What exactly would you like to see legislators within the state also do in order to? Do you want to see him step down as as a response?
What I asked in my release, and it speaks for itself, but I asked the legislature to censure him. Anything else? Other questions? Yeah, Dennis.
One more, if I could. It's a three-part question. How frequently?
Okay, wait a minute.
They're real
I'll be
simple questions,
72
though.
years old. Yeah, but I'm not sure I'll be able to remember 3 questions.
How frequently do you have a conversation with Joe Biden?
Once
When
every
do
2
you think
weeks.
he is going to select a vice president, and who would you like to see him select as a vice president?
Third question, I'm not going to answer. I'm not going to tell you who I think. It's up to him. He's the one who's making that choice. See, what was the second question?
When will he be selecting it? Do you know?
He says this week, next week. That's what he says, and I have no reason to disbelieve it. And the first question,
When do you?
every 2 weeks, every 2 or 3 weeks. I think I'll be talking to him next week.
Are you liking his chances in Pennsylvania at this
Yes.
point?
Anything else? Okay. Well, thank you very much, everybody, and thanks for sitting out in the sun like this. Thank you.